Hi, it's Dr. Mahadevan, and we're going to continue with abdominal pain case 1. As you recall, our patient was a 24-year-old female complaining of severe left lower quadrant pain and dizziness. And as we summarize the case, again, when she arrived in the emergency department, she was pale appearing, she had a weak radial pulse, cool extremities, and her vital signs were notable for a heart rate of 130 and a blood pressure of 90/50, both concerning. So what were our initial interventions for this patient? Again, we want to act in this particular case before thinking. So we started an IV, we placed this patient on oxygen, and we placed her on a cardiac monitor to start. As you recall, her pain was sudden, sharp, and severe. It was 10 out of 10 in her left lower quadrant. It got worse with any kind of movement, and on physical examination, she had left lower quadrant tenderness to palpation and guarding and rebound tenderness as well. And on pelvic examination, she had left adnexal tenderness. So what are some red flags in this patient's history and physical exam? What are red flags? Red flags are elements of the history or physical exam that raise concern for life-threatening conditions. So in this particular patient, there were several red flags in her presentation. The first was the fact that her pain started suddenly. Again, as you recall, sudden onset of abdominal pain is concerning for things such as ruptured AAA, ruptured ovarian cyst or ruptured ectopic pregnancy, bowel obstruction, or ruptured viscus. And so in this particular case, sudden onset of severe pain is a red flag for us. Other red flags were her presentation with a very low blood pressure. As you can recall, her blood pressure was 90 systolic over 50 diastolic, and that is very concerning. When you have a low blood pressure, that suggests that there's volume depletion or hemorrhage, so she may have been vomiting, she may be third spacing fluids, or even more concerning is she may be bleeding to death, and this low blood pressure is a manifestation of that blood loss. And finally, on examination, she had guarding and rebound tenderness. These are peritoneal signs which herald the presence of something serious, generally a surgical condition, and so the fact that she has guarding and rebound or peritoneal signs is another red flag that raises concern about her presentation. So 3 different red flags. And again, as we think about what may be going on in this patient, she has left lower quadrant pain. It was a sudden onset, so it started suddenly. Her blood pressure is low, and she's got peritoneal signs. So what are the things that we need to think about in this patient again? Again, highlighted in blue are the diagnoses of concern: an incarcerated inguinal hernia, ovarian torsion, a ruptured abdominal aortic aneurysm. However, given the patient's age, she being only 24, it would be very unlikely to see this diagnosis in this particular patient. Ruptured ectopic pregnancy. The patient stated that she wasn't really sure when her last menstrual period was, and so ectopic pregnancy is certainly a concern in this patient. Ruptured ovarian cyst, in particular, a ruptured hemorrhagic ovarian cyst, given that the patient is tachycardic and has a low blood pressure. Sigmoid diverticulitis is the other concern, and she could have developed sigmoid diverticulitis, subsequently developed sepsis, and now may be manifesting with tachycardia and a low blood pressure. So these are the diagnoses that are concerning in this particular patient with left lower quadrant pain, sudden onset, low blood pressure, and these peritoneal findings. So as we think about the differential diagnosis, we can look at the discrete elements of her presentation to try to determine which category or which diagnosis fits best. So we'll start with sudden onset. What are disease entities that we're concerned about that may present with sudden onset? They would include ovarian torsion, ruptured ectopic pregnancy, ruptured ovarian cyst, and a ureteral calculi or kidney stone. So those can all present with sudden onset. How about presenting with severe pain? What presents with severe pain? Again, ovarian torsion, ruptured ectopic pregnancy, ruptured ovarian cyst, and ureteral calculi can present with severe pain. What conditions generally present with flank or back pain? In this particular case, only kidney stones or ureteral calculi would present with flank or back pain. Which conditions are generally found in patients who are pregnant? In this particular case, only ruptured ectopic pregnancy of the diagnosis that we're thinking about. Which diagnoses generally present with hypotension or low blood pressure? Generally, it's ruptured ectopic pregnancy or ruptured ovarian cyst. Which diagnoses generally present with fever? In this case, it's diverticulitis. How about peritoneal signs? And which disease conditions would we find guarding or rebound or other peritoneal signs? It would be diverticulitis, ovarian torsion, ectopic pregnancy, and ruptured ovarian cyst. Generally, with kidney stones, there are no peritoneal findings. And then finally, when would we find an adnexal tenderness on examination? Generally, that's only going to be with ovarian torsion, ruptured ectopic pregnancy, and ruptured ovarian cysts. And so if we think about our patient with left lower quadrant pain, we know that she presented with sudden onset, that her pain was severe or 10 out of 10, that she has hypotension or low blood pressure, that she has peritoneal findings, that she has both guarding and rebound on examination, and finally she has left adnexal tenderness. And if we think about which diagnoses fit this pattern, the three that are most concerning are ovarian torsion, ruptured ectopic pregnancy, and ruptured ovarian cyst. So the next step is to proceed with our emergency medicine approach. And remember, we're going to reevaluate the patient. In this case, we got a sample history and did a focused physical exam, which provided very valuable information. We thought about a differential diagnosis and what might be in her differential diagnosis. And now in terms of acting, the things that we're going to do are we're going to perform diagnostic testing to help narrow this differential diagnosis and possibly even identify what's causing her pain. And we're going to begin with some therapeutic interventions. So now it's time to act. So what tests should we order? In patients with abdominal pain, there are a whole host of tests that you can order. A complete blood count, serum electrolytes, urinalysis, a pregnancy test, lipase, electrocardiogram, plain films of the abdomen, ultrasound, and computed tomography. But in this particular patient's case, the tests that are going to be of greatest value are as follows. A complete blood count, not because we're interested in the patient's white count, but because we're interested in finding out what her hematocrit is. A urinalysis to exclude a urinary tract infection or to exclude microscopic hematuria, which we might see with something like a kidney stone. A pregnancy test, as mentioned before, the patient says she wasn't sure when her last menstrual period was, and so we're going to order a pregnancy test to make sure that she's not pregnant, because if she is pregnant, it raises the concern for diagnosis like ectopic pregnancy. And finally, you can make a case for getting a pelvic ultrasound in this patient. Some clinicians might wait until the other tests are back before ordering an ultrasound, but given that she has abdominal pain, hypotension, and left adnexal tenderness and peritoneal findings, obviously an ultrasound might be of value in terms of determining what may be the diagnosis. An area for concern or warning is that in any patient, in any woman of childbearing age presenting with abdominal pain, it's always important to consider ordering a pregnancy test. Many of these women may not know if they're pregnant, in which case you should always get a pregnancy test. But in some women who are absolutely convinced that they're not pregnant, you might find that they may be in error. And sometimes in these patients who absolutely state they are not pregnant, we find that they are. And this is very important because patients that are pregnant, when you are pregnant, it can affect the medications that we might use in that patient. And also, if the patient's pregnant, it opens up specific diagnoses in the differential diagnosis, specifically ectopic pregnancy. And so it's very important to know whether a woman is pregnant or not, even if she says she absolutely isn't. In terms of acting, we've talked about our diagnostic testing. What about the therapeutic interventions? In this particular case, given that the patient is tachycardic and hypotensive, I think it's important that we provide some volume repletion. And again, patients with abdominal pain may be volume depleted for a number of reasons. Either they haven't been eating or drinking, they have been vomiting or had diarrhea, they may be third spacing for some reason, or they may be hemorrhaging within their peritoneal cavity. And so for this reason, starting with volume repletion is always a good idea. And the next step is any patient who's suffering with abdominal pain could certainly benefit from pain relief. And generally in the emergency room, we start with short-acting narcotic analgesics such as morphine or fentanyl. So in this particular case, giving the patient some IV morphine may be of benefit. Now, this used to be controversial. It used to be very controversial to give any patient with abdominal pain in whom you were concerned about a surgical condition pain medications, because the surgeons were always concerned that these pain medications might mask a surgical condition. But the literature and studies have shown that, and in fact, what happens with the administration of of pain medications is that it becomes sometimes easier to make the diagnosis because you take the edge off the patient's pain, make it easier to evaluate them, and in fact, these pain medications do not mask the peritoneal findings, but make them easier to identify on examination. And so you should never withhold narcotic pain medications from any patient with significant abdominal pain just because you're worried about masking their peritoneal signs, but because we know from the literature, from previous studies, that this just isn't true. So what do our diagnostic tests show? We find that the patient's white blood count is 8, that her hematocrit or blood level is 24, which is low, that her urinalysis is normal, and that her pregnancy test comes back and it's positive. And this is obviously very concerning. A positive pregnancy test, anemia, and a patient with left lower quadrant pain is very concerning for ectopic pregnancy. And in fact, a pelvic ultrasound is done and it shows that the uterus is empty. So if we look at this structure right here, we can see that this is the uterus on ultrasound and that it is empty. It does not show a pregnancy within the uterus, even though the patient is pregnant. And if we look at the left ovary, we can see that there is something going on there. And in this particular case, there is a left adnexal mass. So how do we put this all together? Again, the diagnoses we're concerned about in this patient with left lower quadrant pain, hypotension, tachycardia, and peritoneal findings on examination are ovarian torsion, a ruptured ectopic pregnancy, and a ruptured ovarian cyst. But we have additional information from our diagnostic testing. This patient has anemia or a low hematocrit. This patient has an empty uterus and an adnexal mass. And this patient is pregnant. And when you put those three things together with the patient's clinical picture, the one diagnosis that jumps out and is of great concern is an ectopic pregnancy, and even more concerning is a ruptured ectopic pregnancy. So to summarize, you want to think about abdominal pain red flags in any patient presenting with abdominal pain, and these red flags are symptoms or physical exam findings that raise concern for life-threatening conditions. In our particular patient, the red flags were the sudden onset of abdominal pain, hypotension, and the presence of peritoneal findings on physical examination. You want to initiate therapy, including pain relief, even before you determine a final diagnosis. So it's okay to give fluids or pain medications while you're trying to determine what's going on with the patient. You want to utilize diagnostic testing to try and narrow your differential diagnosis, or in some cases, directly identify the cause. And finally, you want to keep an eye out for surgical or life-threatening causes of abdominal pain. Thank you very much.